What is informatics? Informatics is the study of management of information technology. This encompasses all the topics that will be discussed throughout this presentation. These include electronic medical records, computerized physician order entry, CPOEs, electronic ICUs, EICU monitors, and personal digital assistant devices for resource information. So why is this relevant to us as nurses? Everything we utilize in the medical profession falls under the category of informatics in one way or the other. The way data is collected, organized, and assessed are all different uses of informatics. The biggest scope of informatics that we as nurses will utilize is in documentation under the patient's electronic medical records. But there are many other uses for informatics. As you can see, the image on the right shows different uses of informatics in health research, public health, and healthcare. You can look at how there are different links such as health disparity research, healthcare management, identify gaps in primary care, disease management, case management, etc. All of these play a very important role in the care of patients. So how did informatics come about? To facilitate ease of use in informatics, the HIPAA Act in 1996 mandated that all billing to the federal government be done electronically. This means that billing for Medicare and Medicaid patients, their services must be done electronically. As many of you may or may not know, a huge percentage of patients for physicians either come from Medicare or Medicaid. This was a huge incentive to get people to switch to EMRs because obviously they want to get paid for the services they render on these patients using the federal insurance. The shift into medical billing being done electronically did come with some obstacles that needed to be overcome. The main one being that how are we going to bill different services under the same category for the same price across the board? In order to do this and make sure that billing is done correctly and efficiently, the International Classification of Diseases, also known as ICD codes, and current procedural terminology, ICD coding systems were developed. These systems utilize a numbering system to code different diseases, treatment modalities, and procedures. This allows for accurate billing across all departments and facilities in the medical industry. As all new technologies have their growing pains, so does informatics. One of the main challenges associated with informatics is we are starting to lose our high-touch relationship with patients. We are becoming more concerned with the machinery, the computers, and the alarms than actually growing that bond with our patients. It is essential that when we are asking high-risk questions to patients that we are making a connection with them. As mentioned in the human trafficking seminar we attended, the speaker noted that many times when we're asking questions about sexual abuse and physical abuse, we're really just going through the motions. We're reading the computer monitor and not making a real eye connection, emotional connection with the patient. This elicits a response from the patient to maybe not be as honest with their situation as they should be. We need to make sure that we're not losing our high-touch relationship with patients and this bond while we are advancing the technologies used in healthcare. Another thing associated with electronic informatics is that it can heavily hinder patient care if a disaster happens and we happen to lose power. We are so dependent on having our electronic medical records that once we lose power and we have to go to paper charting, we really don't know what to do, and there's not great backup systems for this. In these kind of events, we do need to put more focus on what we are going to do and have a game plan so that we do not hinder patient care.